Shout out to the men in our lives. If you know a man in your life or are a man in your life who is dealing with breasts, let's talk about it. So one of the many ways that men and women are different are that women have significant breast tissue. But men also have breast tissue. Men can get breast cancer, right? And so it should come as no surprise that some men tend to have more breast tissue than others. We call that gynecomastia, or in some cases, pseudo-gynecomastia, which literally translates to a man with boobs. Now, it can be something that is so insignificant in a man's life that it doesn't bother him, but it can rise to the level where it bothers him and he wants to get it addressed. But let's first break down what gynecomastia is and how we classify it. So there are 3 times in a man's life where he may be afflicted with gynecomastia, or more often afflicted with gynecomastia. So the first time in a man's life is around the neonatal time, right? So when he's a baby. And usually that's in the first 3 months of life. And that's because he still has his mom's estrogen coursing through his body. And so at that time, we can see babies, little boys who have a little bit of breast tissue. That usually self-resolves with no need for further intervention. A second time that we see it is at the time of puberty, or pubertal gynecomastia. And again, it has to do with hormones, right? So you have raging amount of hormones going through the body. And at this time, teenage boys, early teenagers, preteens, can develop gynecomastia. This, again, is usually reversible and does not require intervention. However, there are some cases where we see teenagers who persist with their gynecomastia. So if you have a teenage boy, or you are a teenage boy, look at how long you've been dealing with this breast tissue. If it's less than a year, then most likely it should go away and nothing else to do but just have patience through this difficult time. If we start looking at a year, 2 years, then most likely it's not going to retreat on its own and you probably need some intervention. And then a third time is what we call senile gynecomastia, which is when a man is older, and typically as we get older, we become less healthy and rely on some extra zhuzh to keep us healthy, so medications. And so senile gynecomastia is usually related to the number of drugs or polypharmacy that elderly men are relying on to maintain health. And there are things that we can do in our general life as men. I'm not a man, but but there are things that men do in their 20s and 30s that can also get them gynecomastia, right? So again, if you're on a specific drug, there are a lot of drugs that cause gynecomastia. And I mean prescription drugs, not recreational drugs. But marijuana also is a big culprit for inciting and encouraging gynecomastia. And so if you are an avid weed smoker and notice that all of a sudden you're getting breast tissue, then stop the weed and see what happens. And so usually the treatment is wait and see, right? Wait and see, wait and see, wait and see. Stop the offending drugs if you can. Stop the marijuana, and you can, and see how the breast tissue regresses. There is a gynecomastia that can be associated with the syndrome. It's called Klinefelter syndrome. Gynecomastia can also be caused, in really rare cases, by testicular tumors. So part of the workup for gynecomastia in a healthy 20, 30, 40, 50-year-old man who's not really on any other drugs and hasn't had this since they were a teenager is to check the testicles and make sure there's no tumor there. Now, how do we classify gynecomastia? And remember, I also said pseudogynecomastia, right? So gynecomastia in and of itself is having enlarged breast tissue in a man. We think about it in two different ways. We think about not only the amount of breast tissue, but also how it affects the form of the breast, right? So whether or not you get sagging with that in addition to the amount, and how glandular is the breast tissue. Remember that breast tissue is not just fat, even though it feels like that, it can even look like that. It does have glandular components. So it's not just as simple as saying, oh, it's fat and you can just work out and get rid of it. Classification, again, it depends on how glandular it is, how much is there, and also whether or not it affects the form by causing breast ptosis or breast sagginess. And this classification helps us as plastic surgeons figure out what's the best way to remove it. There's also pseudogynecomastia. And pseudogynecomastia is just fat in the area of the breast, giving the appearance of a breast. Pseudogynecomastia is typically seen in men who are overweight and obese. What can the breast tissue do besides just kind of look unsightly? Well, it can also be painful. And so a lot of patients come in saying, I've been dealing with breast pain, not just the fact that there's enlarged breast tissue and it makes me socially uncomfortable, right? But also there's pain associated with it and I want it addressed. So how do we treat it? So again, it depends on how much there is, how glandular it is, and if there's sagginess. So for most patients that I've seen, there hasn't been ptosis. And so you can actually treat it with a combination of lipo to get the nice contour, and then actually direct excision of the glandular part that typically sits right underneath the areola. If there is ptosis, then you also have to think about cutting out the excess skin, and that's something that you can discuss with your plastic surgeon. Does insurance cover this? Yes. Yes, they do. And they want to see pain. They want to see that it causes some psychosocial effects as well. And typically, insurance has had no problem in the past, at least for me, approving treating men with gynecomastia. But I think I stepped too forward. I want to take a step back. So I want to remind you again that gynecomastia is typically self-limiting, meaning that it either regresses on its own, or if you remove the offending agent, then it will regress. The surgery is only indicated in cases where there's no regression. You've tried everything conservatively. You've been to an endocrinologist who's looked at your hormone levels as well, and everything looks normal, but for some reason you can't get rid of the man boob. And that is when you go see your plastic surgeon. So hope this helped. Leave your comments and questions below and subscribe. And as always, love you lots and bye for now.